Good morning. How are
Good
you?
morning. I'm good. I'm good. How are you?
Fine, thank you. What's your name?
My name is Hunana.
It's nice to meet you, Hunana. My name is Sarah, and I'm your licensed professional counselor today.
Okay.
Um, so my practice is based on cognitive behavioral therapy. Um, it's basically evidence-based um, school of therapy that combines cognitive and behavioral techniques that help you to be able to um, change your thoughts, your beliefs, to make change later on, and hopefully modify your behavior and your psychological feelings inside, um, to help relieve some distress that's going on inside you. So that's kind of a little summary about what my practice is about.
Okay.
Tell me a little bit about yourself and what brings you to therapy.
So I actually have anxiety whenever I think about, going to parties or the thought of just meeting someone new or talking in front of people. Like, for example, for my speech class, we have to present like 15-minute speeches in front of the whole class. And I just can't, like, my palms get sweaty. Like,
Mm-hmm.
I feel like my eye is twitching. Like, I just cannot talk to people or anything. Like, just the thought of a whole bunch of people staring at me scares me to death.
So, how do you feel right now talking to me?
I think it's different because you're on a screen, and I know for a fact you won't judge me because I mean you are a therapist. Um,
Okay.
I think it's the thought of people judging me, or I
Okay.
might say something wrong and they might think, I'm this, and when I'm really not. I'm just nervous. I feel
Oh,
like I
okay.
just shut down whenever I, think about other people, like new people.
Okay. So, you are struggling with interacting with new people and possibly having a little bit, not a little bit, a lot of stage fright when presenting. And you are feeling, what are you feeling
Um,
when
I
you feel this, when you have these kind of, I know anxiety is what you're experiencing, but do you have specific feelings related to those?
um I just I just feel very nervous, and I feel sad too because I love like hanging out with people and friends, and I can't, like, because I know my friends are very social. So they like to bring people, but the thought of just meeting new people, like, I don't, I get scared. I get
Scared.
scared and
Mm-hmm.
very nervous. And I don't like that feeling because that's not me as a person. I wish
Okay.
I was very social and, welcoming to other people, but I just shut down. Like, I cannot talk to people.
Okay. So you're this these experiences, this kind of social anxiety makes you feel nervous, scared. It's not really how you want to be.
Mhm.
And you kind of think that people are judging you when
Yeah.
you are interacting with them. Is that correct?
Yes, I shouldn't feel this way. Like, I should be able to talk to individuals. Like, I should be okay with talking to these people, but I just can't. I just really, really can't.
Okay. Okay. I totally understand where you're coming from. Um, Social
And
anxiety. Go ahead.
and this is actually taking a toll on my work too, because I have to interact with patients daily.
Mhm.
And I should be able to just give them their results and that's
Right.
it. But I get nervous, I panic, I everything is in front of me. I literally just have to read off a paper. And I should be able to do this, but
Right.
there's
But
this
that's
block that I cannot
yes.
get over.
Okay. All right. So I noticed that you've been using a lot of language that kind of puts a lot of pressure on you. So um, you've been using the word should a lot, like you should be doing something or you should be able to do something. Do you feel that that is the case?
I do. I
Okay.
do.
So if you're comfortable with this, let's work on changing that language to something a little bit more productive for you and something that might be able to change, that might be able to help you feel less pressure.
Okay.
So, the comment that you made about work, you said you should be able to just be able to talk to them, be able to read off the paper without feeling this kind of panic and nervousness and scaredness, correct?
Mm-hmm.
Okay. So why don't you try and change that phrase from I should be able to talk to people, I should be able to just communicate with them. Change should to something that's a little more productive.
Um, I could say can.
Okay, let's try that.
So I can talk to strangers. Um, I can communicate with patients.
Mm-hmm.
Um,
Do you really believe that you can?
right now, I don't,
Okay.
but I feel that if I change the way of my current thinking, maybe I can. I can do
Eventually.
it. Yeah,
Yeah.
eventually. I mean, I'm sure it takes practice.
Yes.
So maybe I could do this, I don't know, a couple of times a day, just recite it to
Yes.
myself.
Yes. I think that you can be more aware of what you're saying to yourself or what you are saying about yourself and kind of change those pressure words like should to something that's more beneficial to you.
Okay, I can do that.
Um, so you also discussed that you feel that when you are talking with people, they're judging you, or when you're
Hmm.
interacting with them, I don't know, maybe even when you're not interacting with them, maybe they still think you still think that they're judging you. Is that correct?
Yes, I feel that because I'm quiet and more reserved around new people, they might think I'm stuck up
Okay.
or I just don't like them, and that's not the case at all. I just,
Okay.
I just, I don't know. I don't know what to say or what the right thing to say is. I'm not
Okay.
trying to be stuck up. I just don't know what to say.
Okay. So have you considered that there's a possibility that these those people don't believe that about you?
No, I don't. Just the first thought is that they're going to judge me, like because they don't know me.
Okay.
And I know for a person to know me, it takes time, but it's just all these negative thoughts just keep coming into my head that I shouldn't be there. Like I should just go home. They're gonna
Okay.
judge me.
Okay.
Um, and
So,
yeah.
okay. So, can you maybe give me some evidence that these people are not judging you or these people aren't thinking that those horrible things about you?
Well, I know like last week I went to a birthday party and again I was quiet and I noticed that like the people that I met, they were actually trying to talk to me. Like they were
Oh,
going out
okay.
of their way to make me feel comfortable, but I just couldn't get out of that mental state. of
Hmm.
I shouldn't be there.
Right.
Um, but no, they would, let's say they're sitting like across the table or like somewhere far. Like a lady came and she sat next to me and we talked and we
Hmm.
were just having a normal conversation. And at that point, I did feel a little bit at ease because the judgment state wasn't like a huge thought. Maybe in the back of my head, I thought that she might judge me, but it wasn't like a big deal at that point.
Okay. So that's a really good evidence to show you that in most cases people aren't judging you and they want to talk to you. And
Okay.
so maybe when you have these feelings of people are judging me or I shouldn't be here, remember this instance or this event to kind of help you understand that not everybody is out to get you.
Yeah, okay. So I should look at their body language and try to have more positive thoughts, I guess, and
Yes. And
put myself at a higher, I guess, place.
yeah. And
Okay.
also just remember that specifically for this instance, this person wanted to talk to you and you clearly expressed that you felt a little more at ease when this lady talked to you and you were able to communicate to them. So it's very clear evidence that you have the ability to talk to people and that
Okay.
these other people want to talk to you too.
Okay. So
So just
how
go ahead.
I know this is like one-on-one. How would I address this in like maybe a group setting?
Okay. Yeah, definitely. So, when you are you saying specifically like you're in like a group going to the movies or like when you are presenting to some people?
Let's do the presenting to people because class.
Yes,
Yeah.
definitely. So, you're presenting to 15 people, you're kind of panicking about um what's happening. So, do you have any instances in your life where you have had to present to people and it was successful?
Yeah, in the class, like I I know that the students won't judge me. Like they clap, like they appreciate that I had the courage to go up there, even though I'm freaking out the whole time. Um, they show support
Mhm.
whenever I do go up there. It's just
Yes.
I think before I get up there, the thoughts just go crazy in my head.
Right. Okay, can you give me a few examples of those thoughts?
Um, they're going to laugh at me, or I'm gonna forget what I'm talking about,
Okay.
or yeah.
So there's a technique in CBT called thought stopping.
Okay.
And what you do is when you have these thoughts that are kind of causing you to spiral out of control, kind of like that,
Hmm.
or going into a more panic state,
Okay.
you can either silently or out loud tell yourself to stop
Oh,
so that you are attempting to not spiral out of control before your presentation.
okay.
And another really cool tip is that um, you can use something like a rubber band to tell
Okay.
yourself to stop. It's kind of like a behavioral modification type thing to get
Okay.
to get yourself to stop thinking in that way. And then once you tell yourself to stop, you say other things that could possibly help you um, move past the situation. So you said that you're afraid that people will laugh at you.
Hmm.
You could say something like, um, people clap for me at the end of my presentation. Um,
Okay.
you could say, um, people are, you could say something like, we all have to do this.
Okay.
Um,
Oh, okay.
something else that will help move your mindset from, oh, my belief is that these people are going to laugh at me. Well, my new belief is that people are going to clap for me, or
Okay.
I can actually, I actually can do this. Does
Okay.
that make sense?
It does. It does. Okay.
So how do you feel after discussing um, this with me today?
I feel much better. I want to actually do the exercises that you told me. In particular,
Outside of,
the stop one. Yes,
oh, you like
outside
that
of
one a lot?
I do because I feel like I do have a lot of negative thoughts,
Mm-hmm.
and if I could just yell stop or like, have the rubber band trick, I feel like I could actually overcome this anxiety, this like panic feeling whenever I'm around people or if I need to present.
Good, very
Okay.
good.
Mhm.
So a lot of what therapy is working outside of therapy sessions. So I want you to use these tools, obviously, when you have a presentation or when you're in a situation where um, somebody, you want to interact with somebody.
Okay.
Um, so are you interested in scheduling another session?
I am. I am. Mhm.
Okay, good. So roughly same time next week.
Okay. Sounds good.
Okay, perfect.
All
Nice
right.
meeting you.
Nice meeting you.
Okay.